So we've had some really interesting sessions on Tuesday, as Tina was saying, and now we are going to unpack this, what I shared and others shared on day one on some of the things that we talked about. And this one is particularly going to focus more on human-centered design and working with people-centered approach to doing the demand promotion and the SPC work we do. So what I'm going to take you through is to really share with you a tool which is very simple, but it helps you to really think about the logic about how people make decisions or not make decisions to go for vaccination. So each of us go through our different stages, and a lot of other factors would influence us to decide or not to decide to go for vaccination. Next. So basically, the learning objective is really to come to a shared understanding how the behaviors are affected. And it's when a human being makes a decision, it's not just by herself or himself. A lot of other factors come into play at interpersonal level, the community, the systems, and the policy factors, which each has a unique influence on our decisions. We would be introduced to the importance of using tailored strategies to address the needs of various people at various points of the journey. And then we will learn some innovative ways in which effective interventions can be designed together with the community at each stage of the journey that we go through. Next. Can colleagues please keep their mics on mute, please? So I think we'll go through it, this one at the end. If we can go through the next slide, please.
No, go on.
Next slide, please. Okay, so the journey to immunization, as I was saying, is a very simple tool that UNICEF started some years back, in which we really look at what are the different stages of a person's journey. And it has been really adapted and used by many different partners, from CDC to WHO to Gavi, and also Gates in some documents. But this is something which has been used as a very simple tool, which helps people to think through. So next one. So I'll like to just start by saying that there's a wealth of experience in this team. We are 133 people there in this room now, or wherever you are, or collectively. So we've got a wealth of collective wisdom in which we worked in vaccine demand, we worked in public health emergency response and health promotion. And collectively, if we just even take 5 years as our mean, we'd be more than 600 years of experience among us. So we're really talking to people who have done a tremendous amount of work in SPC. We also know the types of challenges individuals in each of our countries and communities face in accessing health services, and what kind of solutions seem to have worked to generate demand for vaccines, or to promote vaccines rather, because there is demand, but it's about just expanding what is already happening. So in 2021, we have 20 and 2021 were very difficult years, but we also have learned a lot about what it means to roll out a new vaccine, in this case, COVID-19 vaccine. So what we are trying to do is we are going to put your knowledge to test on a lighter manner, but honestly to work together collectively to understand what would be some of the influencing factors which helps in making decisions to go for vaccination. Next. So I'll take you, this is a scenario, and based on this scenario, the teams will be working in their little groups facilitated by your wonderful facilitators who've agreed to help us out. So this is a persona. Fikile is a young girl of 24 years old, and she's working in a big metropolitan city in country X. Like all other youngsters, she loves talking to friends on WhatsApp when she is working at a retail store. She dreams of saving up enough money so that she can go to the university to get a business degree. Her family has been impacted by COVID-19. Some of the family members have lost their jobs, so there is an economic impact, but one of her grandparents is in the hospital. Her younger siblings have also been affected because of COVID-19. They have not been able, because schools were closed, they were not able to go to school, they stayed at home. Her community is a religious one and has returned to large gatherings now on Sundays for in-person worship. So there's already a red alert there that too many people gathering together. Next. So in the beginning, when the Ministry of Health gave guidance on what should be the do's and don'ts to prevent the COVID-19 virus, she used to wear masks regularly on public transportation, but now she has become really tired of these avoiding crowds and not being able to see her friends. She hasn't worn a mask in many weeks because no one in her family, neither her friends, use a mask. Fikile is eligible for COVID-19 vaccine since December 2021, but she hasn't yet got vaccinated yet. However, her mother, who is a retired nurse, has gotten vaccinated, but interestingly, she hasn't convinced her father or anyone else in the family to do so. Next. So based on this scenario and guided by your facilitator in your working team of about 12 to 15 people in a Zoom breakout room, you will be asked to go through two things. First of all, discuss Fikile's journey and what could be the reasons why she may not be vaccinated yet, and what could motivate her to take that journey where she would end up getting vaccinated. You may have a similar population in your own countries or in your own communities, young people like Fikile, where you can resonate with. So what are the reasons that they have not vaccinated yet? So you can consider access issues, equity, and vaccine confidence challenges as you go through the exercise. So what we would like you to do is to use the red stickies, working with the facilitator to map out the barriers that Fikile may encounter along the journey. So about 10 minutes. And then using green stickies, work with the facilitator to map the enablers, because it's not just the barriers. We also need to think about enablers which could help, because we need to come up with the solutions which would be practical and logical for that particular community. So the whole exercise is about 30 minutes. Next. So this is what we are talking about when we speak about the journey to immunization. We started calling it a caregiver's journey, and then journey to health. So basically what it means is that how do we make people accept vaccination and get vaccinated at the end of the day? So just taking you through some of the things. As is the usual case with any SBC program, the knowledge has got quite a big influence, whether you know about the vaccination, whether you believe in it. So in this case, COVID-19 susceptibility and severity, do we think that this is serious enough so that we need to be vaccinated, particularly after Omicron, we may have diminished risk perception. The vaccine safety and efficacy, do we trust that it is safe and is it effective? How long does it actually protect you from vaccines? And the recommendations that are being given by the authority, including Ministry of Health, it could be WHO, UNICEF, or others, CDC, others as well. And then the second step is if we have enough knowledge and we have an intention, then the next step would be the intention. Do we intend to really get vaccinated then? Do we trust in vaccination and the vaccinators and the health and the government as a whole? Do we believe in the benefit of vaccination and vaccination norms? Is it a social norm? Are other people getting vaccinated? Are my friends okay with it? Or are they going to make fun of me if I go and get vaccinated? Then the third part we need to really consider is to look at the preparation stage and what is the cost and what is the effort that would be needed to go for vaccination. Is the appointment scheduling easy or is it very complicated? Vaccine appointment cost, are we expected to pay for the cost? Logistics, transportation, it would have a cost implication and everybody may not be able to afford it, and especially if the distance is too far. And time spent at appointment is also, we have to factor in the opportunity cost, because somebody who's coming from from a rural community or poor community may not be able to afford it, because that would be time away from work. The fourth thing we're looking at is point of service. And when they go there, is it convenient? Is the outreach closer to where they would be able to go? Accessibility and safety issues. And then the fifth we are looking at is experience of care. Is the health worker nice, or is the health worker rude? Is he or she explaining side effects to us? Do they answer our concerns and some of the fears that we have towards vaccination? And then the last part we also need to factor in is the after service. What that means is that, okay, the person may have got vaccinated, but if it was not easy, if the health worker was rude and they had to wait for a long time in a queue, then that would have a negative impression on the person, and they may decide not to go for the second dose or not take the child to the second dose if it's a routine immunization. Another thing is if there's adverse events following immunization, even if it's a minor side effect, and if the health worker may not have explained it, if the child kept on crying for a while, or if you had an abscess, then that would also discourage you from going back, but also the person is likely to talk about negatively with others. But there would be some, you also need to look at the positive factors, like in the case of Fikile's mother. She already has been vaccinated, and she would be a positive person to talk about the experience of being vaccinated. So all these things at different stages of the journey would be very important for us, so that we understand what are the problems and how to address with a local contextualized strategy. We are taking an example of COVID-19 here, but this tool can be used for practically anything on health service acceptance. So routine immunization definitely, but also other areas of public health. So yeah, so next I think that we would now be going into the group works.